Hello, my name is Bailey Moore, and I am presenting on my thesis, From Slavery to Systemic Barriers, exploring the impact of historical trauma on heritable stress and healthcare education on Black breastfeeding experiences. I'll walk you through four main sections. First, an overview of why breastfeeding matters, especially for Black mothers. Then we'll examine historical and inherited stressors before shifting into the biological imprint of trauma across generations. Finally, I'll share findings from my expert interviews and student focus groups that highlight how provider education can be reimagined to better support Black families. So, why breastfeeding matters for Black mothers? Human breast milk has been extensively researched and proven to provide critical nutrients for infant immune and growth development. A lot of big organizations such as the World Health Organization, Academy of Breastfeeding Medicine, and the American Academy of Pediatrics recommend nothing but breast milk for the first 6 months of a baby's life. Human breast milk has long been recognized as a vital source of nourishment, immunity, and emotional connection. For babies, it reduces the risk of SIDS, diabetes, and infections. For mothers, it lowers the risk of breast cancer, hypertension, and stress. It adapts to meet the infant's needs, truly liquid gold. And yet, while these benefits are universal, access and support for breastfeeding are not. That brings us to the why behind this project. While breastfeeding rates rose overall over the past 25 years in the US, African American mothers have persistently lagged behind, showing by far the lowest breastfeeding rates. These historical harms aren't abstract. They live on in medical systems and patient experiences. Black women were used as unconsenting wet nurses, they were experimented on without anesthesia, they were separated from their babies to feed white infants. These dehumanizing experiences disrupted cultural knowledge transfer around birth and breastfeeding and laid the foundation for medical mistrust that persists today. So, how does trauma live in the body and across generations? So, what happens when trauma isn't just emotional, but biological? Inheritable or transgenerational stress is the idea that the emotional and physiological impacts of trauma can be passed from one generation to the next, without that next generation ever experiencing the trauma directly. In Black women, this shows up as higher rates of preterm birth, chronic stress, and disrupted lactation, rooted in epigenetic changes like DNA methylation, often triggered by systemic racism and chronic stress. So, why must provider education change? With all of this history and science in mind, we have to ask, are our providers trained to recognize and respond to this context? The answer is rarely. Provider education often lacks cultural and historical competency. Lactation training is minimal, and bias, conscious or unconscious, continues to shape care. If we want to support Black maternal health, education must go beyond biology to include trauma-informed, anti-racist, and culturally congruent frameworks. To explore this further, I conducted a focus group of nursing students enrolled in a lactation course at Charles R. Drew University of Medicine and Science and interviewed 6 experts in maternal health, lactation, public health, and midwifery. I asked them about their education, gaps they experience, and what they believe is needed to better serve Black mothers. From students, one theme was a lack of historical context. One said, I didn't know about wet nursing until this course, but many also felt empowered. Another saying, it changed how I talked to my patients. Experts emphasize structural racism. One said, Black mothers often need permission to breastfeed. It's not about desire, it's about trauma. And others push for accountability, saying support shouldn't depend on personal belief. It's a clinical obligation. These voices affirm that meaningful change begins with education, and that education must be historically informed and culturally centered. This research matters because Black women deserve more than survival. They deserve thriving, safe, supported births and postpartum care. I want to thank my mentor, Dr. Bita Amani, for her unwavering guidance, and the students and experts who shared their voices, their stories, and their vision for a more just maternal health system. And to every mother, healer, and advocate reclaiming birth and breastfeeding as sites of resistance, thank you for witnessing this work.